Dealing with the plantar wart can bring about a lot of different emotion. Maybe you've tried a lot of different treatments. Despite all the different options, this wart just isn't going away. As a foot doctor or podiatrist, plantar warts are one of the many things that we deal with and treat. Sometimes people can struggle with these warts for years until they find a certain combination of treatments that works for them. So here are my 4 reasons that your plantar wart isn't going away. And who am I? My name is Dr. Tarr. I'm a board certified podiatrist in private practice in Tempe, Arizona. And I own a small practice called Direct Podiatry Arizona. What is a plantar wart? A plantar wart is a wart found on your foot. A lot of times they do like to infect the soles or the bottom of your foot, the surface that you walk on, but sometimes they can attack the sides of your foot or your toes, the tops of your toes as well. Plantar warts are actually caused by human papillomavirus or HPV, the same virus that is responsible for cases of cervical cancer and penile cancer. Now, because you have a plantar wart, does that mean that you have the same strain of HPV that causes these cancers? No. There are over 100 strains of the HPV virus. Some of them increase your risk for developing certain cancers. Some of them will lead to plantar warts. HPV strains 1 and 2 specifically are responsible for plantar warts. How these strains of HPV even come into contact with your feet in the first place, usually through very, very minor or microscopic cuts or breaks in the skin. Once the virus is inside of your body, HPV causes very rapid, very fast, and very unorganized cell growth. And that leads to the wart that you see on your foot. So these warts can be painful. It can feel like you're walking on a rock, on a pebble. They can even bleed at times. So in my experience as a board certified podiatrist, there are 4 reasons why your plantar wart isn't going away. 1, your immune system, and a weakened immune system at that. Your immune system does play a vital role in fighting off viruses. And if your immune system is weak or not working as well as it should due to stress, due to other health issues, due to diet or lifestyle factors, it can make it a lot harder to clear the plantar wart or for it to go away. Vitamin deficiencies like zinc, magnesium can affect your immune system, making it much harder to fight off any infection, but including the infection causing your plantar wart. If you're consistently not getting enough sleep, this can also weaken your immune system and make it much harder for you to clear your plantar wart. So it's important that if you have been dealing with a plantar wart, especially for a while, that isn't getting better despite different treatments that you've tried, find a foot doctor that has knowledge about clearing plantar warts and will take all of these factors into account and get to the root of specifically why you have been unable to clear this plantar wart and how to get it to go away for good. The second reason why your plantar wart isn't going away, the chosen treatment isn't right for you or for your situation. Not all plantar warts will respond in the same way, and treatment for plantar warts isn't one size fits all. Some people will respond to certain treatments better than others. So again, it's important to see a foot doctor that has a wide array of treatment options that they use in addition to medications that can be applied on the wart itself, and taking into account the patient's diet, lifestyle, and other factors. One of my favorite treatments for treating a plantar wart is through Faulkner's needling. Faulkner's needling is great for warts that have been around for a while that have been resistant to other forms of treatment. And it's pretty simple. How this works is that your doctor or myself injects a little bit of local anesthesia, usually lidocaine, around the wart so that you don't feel any pain or discomfort during this procedure. And then after you're numb, a needle is used to poke tiny holes throughout the wart. The goal is to drive the virus actually deeper into the skin. This will cause your body to respond with a stronger immune response. Once your body recognizes this virus as foreign, it's able to attack it, and then your plantar wart ideally will heal and go away. Faulkner's needling actually has a very high success rate of about 85%, and full results are seen over 3 months. Sometimes surgical removal of a plantar wart is an option, and that involves, again, numbing you up so that you're comfortable and cutting out the wart and stitching the skin back together. So this obviously is the most invasive, the most involved out of all treatment options. It does require some downtime, but this option does exist if needed. I've only had to do this maybe once. The third reason why your plantar wart isn't getting better or why your plantar wart is coming back is that maybe it's not actually a plantar wart at all. Maybe you received the wrong diagnosis. A plantar wart can look a lot like other skin issues that go on in your feet, especially if you have been self-diagnosed. It is a possibility that you gave yourself the wrong diagnosis. But even going to a doctor sometimes, especially if you go to a doctor that doesn't have a lot of experience with seeing plantar warts, treating plantar warts, wrong diagnosis is also definitely very possible. So because of that, any over-the-counter treatments or even treatments actually done in office on something that isn't a plantar wart won't clear it up. For example, a callus or corn can look a lot like a wart to the untrained eye. Calluses can be very painful just like warts, but because it's a callus, it's dead skin, it's not caused by an infection, it won't respond to the same treatments that a wart will. So other skin growths will not respond to plantar wart treatment. And in worst cases, skin cancer like melanoma definitely will not respond to wart treatment. This is why it's important any new skin changes to your feet, especially skin changes that you have been dealing with for a while, please see your local podiatrist, especially if it's changing in size, growing. When you come to your podiatrist or a foot doctor, we can biopsy, which means take a small piece of that area, remove it, send it to a lab and see what exactly is growing. So we can see if it's a callus, if it is actually a wart, or if it is something else. Once we know what this growth is, we can treat it and address it properly. And the fourth and final reason why your plantar wart isn't going away is that you're possibly reinfecting yourself. Even if you've tried all the treatment options that are available to you and attempt to get your plantar wart to go away, maybe you're still unknowingly participating in certain behaviors that are allowing the virus to stay. Certain things that will increase your risk of developing a plantar wart over time or your plantar wart not going away include being barefoot in public spaces. So actually HPV strains 1 and 2 that are responsible for plantar warts can live on surfaces dormant for years. Being barefoot in locker rooms, spas, in airplanes can set you up for a reinfection or infection the first time. It's recommended if you are in public spaces, your shoes should be on. At least have slippers on or a pair of socks with you to throw on. Another behavior is sharing shoes or socks with other people. Never a good idea. In addition to picking up plantar warts, you can increase your risk of picking up athlete's foot, of nail fungus, a lot of different infectious diseases that can affect your feet. So never a good idea to share shoes or socks with anyone. Another behavior that can cause you to be reinfecting yourself is picking at a wart. Again, some people have a tendency to pick and maybe they don't even know that what they're dealing with is a wart. So they pick at it. And every time you do that, you're causing little micro tears or even larger tears that you can see in the skin. And that virus is able to spread to other parts of your foot. The last behavior, not properly disinfecting places where your foot is. So usually your shoes. So I usually will recommend to patients, once I've diagnosed them with having a plantar wart, to spray the inside of all of their shoes extremely well every time they wear them with disinfectant. And this will lower your risk of reinfecting yourself or infecting someone else. So having a plantar wart can be really stressful, especially if it doesn't go away. From unknowingly or accidentally reinfecting yourself, or maybe just not having the right combination of treatments for you. These are all different reasons why your plantar wart can hang around a lot longer. If you've been dealing with this problem for a while, definitely see a podiatrist in your area. That is it for my top 4 reasons that your plantar wart isn't going away. Feel free to leave any comments down in the comment section below. If you've dealt with a plantar wart ever in your life, what was that experience like? What helped? What didn't help? If you liked this video today, like, comment, and share this video with someone that you know. If you would like to see more content from me, subscribe and be sure to turn on that notification bell so that you can be notified whenever I post a new video. In the description box below, I will have a link to a blog post about this topic. that I wrote. I also will have a link to join my email newsletter so you can receive weekly blog posts from me on different foot health related topics, and a link to my practice website, Direct Podiatry Arizona. So until next time, everyone, take care and have a good day. Bye.